Um, okay. So one might be described as an issue. Race dysphoria might be described as an issue. Would you describe gender dysphoria in the same manner or a different manner?
I would say it's the same manner that,
Okay.
you have a chemical imbalance that's making you feel that way, because there's no logical reason for you to feel that way unless, again, it's from trauma where something has happened that made you feel that way. Like a lot of people who have, gender dysphoria and body dysphoria, it's from rape or past trauma.
Yeah.
Yeah.
That is not the answer I was expecting. Wow, okay. Um, okay. If there is this trauma behind it or this chemical imbalance, should we try to, in treatment, should we try to address that instead of the kind of affirming or... So you're walking by, you've seen me before, I'm talking, the microphone should be over here. First interview of the day. I'm not in the zone yet, you know what I'm saying?
Yeah.
But what intrigued you?
I guess the gender affirming care question is really controversial, so I'm interested in that. And I've seen you before, so I'm just interested in talking in general.
Did you know that I was an alien?
No.
Oh, yeah, that's something people don't know about me, and always don't talk to strangers, but we're not strangers because you've seen me out here before. Yeah. So why is it interesting?
I think it's interesting because it really depends on your definition of gender affirming care.
Okay. What is your definition?
I suppose any way that helps someone feel better about their gender identity.
Okay. So that, to me, now, correct me if I'm misunderstanding, that kind of sounds like kind of like a psychotherapy or a therapy or, okay.
As a psychology student, I feel like it's mainly based around therapy and stuff. It doesn't always have to be surgery. So.
Okay, that makes...
Is that your definition of it? Is more so surgery side?
I think that's part of it. Okay. I would say that it would fall under an umbrella of... It would include psychology, right? And then it would also include surgery. Yep. It would also include supplement hormones, medications, all that kind of stuff. Is there anything else under that umbrella? Not that I can think of. Is that under the umbrella for you? Do you include all those other things too, or just mostly the psychology?
I would say all the other things are included, yeah.
Okay. And is there any hard line for children that, and when I say children, I mean anybody under the age of 18?
Yeah.
Is there any hard line where it's that part of gender affirming care should not be done?
I do believe that you should wait until you're 18 to have surgery, as same as testosterone blockers and stuff, only because I've been to schools where I had friends who were on T and stuff, and it's not always a permanent choice. I know it's not always a phase, but it's definitely not always a permanent choice after they turn 18. I know a lot of people who reversed their gender affirming care.
Okay, so should wait till 18 for surgery. What about medications?
Yeah, I think you should definitely wait until you're at least in your teens and after puberty to start any medications, just because it can affect your body's hormones and stuff. But I do think that all therapy should be required the second that you start questioning anything. You should be given therapy.
Okay, therapy. Okay. What is there a specific type of therapy that you should be given?
I don't think there's a specific type. I think it's just important to discuss it, especially as a young child who has so many questions. Having a professional to talk to is very important.
Okay, I think that makes sense. I'm on board with you. How does that conversation with a professional go? Is it? I want to be careful with how I word this. Do you want to affirm everything that they believe, or do you want to dig deeper into come from a neutral standpoint?
Yeah, I think it's digging deeper and understanding why they feel the need to change their gender in general, and just how you can help them feel better about themselves without surgery right away.
Okay. And does that always include affirming the gender, or does that sometimes include hey, it seems like you are really depressed or anxious, or maybe there's something else going on that might be have some sort of impact on these feelings that you're having? Is that part of the conversation?
It definitely could be, but I still think affirming that their feelings are valid because they're feeling them is important. Even if we don't want to pursue surgery or push them into getting surgery or medication, it's still important to not dismiss their feelings.
Okay. So accept and understand the feelings, that's what I'm hearing.
Yeah.
And then what about the strategy? How would a professional, or should a professional, advise a person who is seeking this therapy to act on those feelings? What do they advise?
I suggest, especially as a psychology student, to take some time to think about it and discuss with your family and discuss with friends and more professionals than just one. Like, I think multiple opinions is very important and not just taking the word of one person.
Okay, that makes sense. Is there ever a point where this professional should make a evaluation, determination, analysis, diagnosis, and be like, hey, I think that you are trans or you are the opposite gender? Is that something that they should do?
No, I don't think that's up to a professional to decide ever. I think that's really a person's personal choice. I think that they can say you have body dysmorphia, you have like a specific diagnosis, but diagnosing someone as trans is not a thing.
Okay, that's not a thing. You said body dysphoria, so that's like believing that you should have had a different sex?
It's believing that you don't feel comfortable in your own personal body.
Okay.
Sounds like dysmorphia, dysphoria, like feeling uneasy in who you are as a person.
Okay. Does that include like if someone is overweight or...
Yes, it does.
Okay. And is that like the same thing as having gender dysphoria or something different?
I believe it's a little bit different, but it's roughly the same, like dysphoric mindset in general that makes you feel like you aren't supposed to be who you are.
Okay. Okay. Would body dysphoria of the gender variety, should that lead to medications or surgery ever?
At some points, I would say yes, if it's been going on for an extended period of time. Like, I would say probably 5 years after you turn 18, I would turn to surgery personally if I felt like that. But I've never had those feelings, so I never really thought that deeply on it.
Okay. Do you know what would the surgery do you think to like the mind? Would it help a person? Do you think it would make them feel better? What's the thought process?
I definitely think it's a case by case because I've seen both sides of it. Like, I know people personally who have had like surgeries and then wanted to get them reversed, and I know people who have gotten the surgery and then felt like amazing after and felt like totally affirmed in their care, I suppose. But yeah, it's really case by case.
Okay. Do you think someone can... how does someone know if like the surgery or the hormones or any of that stuff that's more permanent rather than just like talking with someone or choosing a different pronoun or something? How does that, like, how do you know if you should do that? Like,
I think starting out by having those conversations with professionals and even maybe like cross-dressing or literally anything to make yourself more comfortable with getting to that next step, but it's never really like a total for sure, like if you would know that it would help you better, like be better or not. So it's really like a guessing game, I guess. The same as like if I were to ask you if adopting a child would make your life more fulfilling. It's really a case-by-case type deal. So can I ask why you chose this question?
I think I chose this question because like it's a hot topic, right?
Yes.
It's something that engages people. I think it's something that in the United States and probably in other countries too, it's one that's highly debated. There's people on both sides. I recently had a conversation with someone who... actually quite a few people. It was a group conversation. One of the people went through gender-affirming care. They were born female, and then they went through a transition, and then they had a lot of regret from that transition and a lot of trauma. And then there was another person who did not, but they were kind of against it. And then there was another person who is very for gender-affirming care. And their son is actually, what's it called when they, them, those kind of pronouns? It's slipping my mind. Non-binary. That is correct. Sorry. Wow, that's what I meant. But yeah, it was an interesting conversation. And I found myself in like 2019 being very, very pro gender-affirming care. And then I kind of slipped into a neutral position, and now I think I'm probably one step past that neutral. And now I'm like, maybe we should be really careful about this in case, there might be harm occurring.
Do you think you're only iffy on it for children or iffy for everyone?
Here's what I think. For children, definitely iffy. Definitely, I don't think it should happen. That's kind of my hard stance there. For adults, I think that adults should have the freedom to do what they please. They're adults. They should be able to handle these difficult decisions, right? And it's their responsibility for their own body. So I think if they want to do something like this, they should have that freedom to do so. And I just blow my cover. Now it's not my first day here on Earth, but yeah. What do you think about that?
I definitely agree, but again, I think therapy should be required for every single person who's seeking gender-affirming care, just so that they have a professional to discuss things with. I don't think it should be like an at-will kind of thing where you can just go into your doctor and be like, hey, I'm ready to get a sex change operation. I definitely think it is a whole process, and there should be aftercare too. You should be continuously going to therapy, your whole life, pretty much.
Yeah, I mean, maybe that applies to most people.
Yeah, I definitely agree.
Yeah, so it shouldn't be done on day 1, day 2, month 2, year 2, maybe sometime down that road. I think I asked this earlier, but I'm going to try to ask it again. You go through that whole process of therapy. You're in therapy for years, let's say. How do you figure that out, whether you should or shouldn't?
I definitely think support groups should be a thing. Other people who had gone through transitions should get into a support group and all discuss how that affected their lives, how that made them feel, how they feel afterwards now. And then there's people who are in there from before, getting that knowledge and background from people who have actually been through it firsthand, so they can use that to evaluate how they want to proceed.
Okay. Yeah, that's fair. Support groups, I think that's wonderful, right? I'm still, I'd like to dig just a little bit deeper. It feels like it's on the surface. It's there's these things you can do to talk about it, but what do you actually talk about? What do you actually discuss? Is there this aha moment? Is there something you look for?
Do you want to join in on the conversation?
You may.
I have no idea what's going on.
We're talking about gender-affirming care with children.
Huh?
Gender-affirming care for kids.
Oh.
Sex change operations.
Oh, okay.
Are you interested in discussing?
Sure.
Get on in here. We're adding another person.
That's perfectly
Repeat
fine.
your question for us both.
Yeah. So I didn't even catch your name. I'm so sorry.
Jasmine.
Jasmine. Okay.
Yeah, Shane. Nice to meet
Shane. Okay. I'm Pierce or Alan. I blew my cover with her. So it's my first day. I'm an alien, but she knows I'm not now. But anyways, we were talking about gender-affirming care, and I've already forgotten Allison.
Jasmine.
Yes. What is wrong with my brain? Jasmine. Wow. So she was talking about how you should go to probably years, I think you were saying, of therapy, and then after that, maybe you can figure out whether you should have a sex change operation, right? If you should start hormones, if you should do that kind of stuff. And she's like, group therapy, and I'm like, yeah, I think group therapy is great, but then it's what do you look for in that group therapy? Is there an aha moment? Do you dig deeper? What do you talk about that gets you to that moment where it's okay, I know I'm going this way. I know I'm going this way.
I think discussing everyone's traumas and positive effects and things that they noticed before and after surgery is really important, just so you can make your own personal opinion on it.
Gotcha.
I
think that it depends on where the person is at. If they're 6 or something saying, oh, I'm a guy and I want to be a girl, then no, you can't just do it that soon.
Yeah.
But if you're 16, 17 saying, I want to be a girl, I'm a guy, I want to have a sex change operation, then yeah, you should start working towards that.
Okay.
It's ultimately down to the experience of the person, and if they're willing to understand the consequences and the actions of the sex change.
Okay. Interesting. So we got, your answer was talk about the experiences, what the pros might be, what the cons might be. I'm not sure I heard the younger kids, that should kind of be discarded because they're too young. That's what it kind of sounds like to me. Okay. And then the older kids, you kind of said they should just have that freedom, I think you kind of were saying. Okay. What should they look for to know whether this is something they really want to do, or if it's something that they they might regret?
Yeah. Well, as you're growing up, you go through different phases and whatnot. Like, I used to grow up thinking that I would be a great soccer player, but I ended up just not playing it. I jumped around like different stuff, figuring out what I liked. And if you end up figuring out saying, hey, I'm a guy and I want to be a girl, or vice versa, for long enough, and as you're of age and like you're old enough to understand that this is a choice that I likely cannot come back from, then yeah, you should have the choice to do that.
I do think that seeking therapy is still very important before you make that decision.
Yeah.
Just because you need it.
To help get the understanding of it.
Yeah, and especially for children, rather than just like discarding it completely, I still think they should go to therapy. I still think there should be a talk about why they ever felt that in the first place.
So you mentioned like the life experiences. I wonder how those play into this decision, and how, like, let's say someone attends this group therapy and they hear experiences from other people, because that's what group therapy is, correct? Okay. And then they're like, wow, that person had a really good experience. And then maybe they hear another person and maybe it wasn't such a good experience. I guess, how does that shape what that decision? Like, how do you figure out like what you should do?
I think it really helps them weigh the pros and cons, because it gives them a real life example. Like, it's not just seeing it on social media or seeing it in the movies or things like that. It's an actual real life example, and it helps them to weigh that it's going to affect their life forever. Like, it's something that you likely can't fully come back from. So
Yeah, agreed.
do you have any thoughts?
I agree. I mean, if going to therapy and actually understanding on like these people experiences could help determine on whether you do want to follow through or you don't want to follow through. Because most people that whenever you talk about sexuality and whatnot are approaching puberty and whatnot, so they got a lot of questions about sexuality, who they should like, who they shouldn't like. And with everyone saying that, oh, you should only date one guy, or you should only date, or you should sleep around with a bunch of women, it's just a lot of people saying a lot of things. So having the understanding of other people could help determine your point of view.
I definitely think with the aspect of like religion as well, like if someone grew up in the church, having people who weren't growing up in the church to discuss this with is very important, because having like a religious mindset about all of this like alters everything.
Yeah, church sucks, right?
I'm iffy.
Okay.
Yeah, my mom went to a Catholic church.
So did mine.
When she was growing up in London. So yeah, no, it was terrible from her experiences.
Okay. We've been talking a little while. So I think Jasmine, I remembered your name this time. Your position here is like, someone can know if they are trans. Actually, let me back up one step, just confirm something first. If someone wants to seek these permanent changes, we would consider them transgender, right? Or
Not usually, no. You can always say that they're like body dysphoric, like I was saying before, because just because you want, like, for example, if I get a breast reduction, does that make me trans?
I don't think so.
It's still gender-affirming care.
Okay.
Yes.
If you were to have gender-affirming care that's permanent, that would be changing, or attempting at least, to change your gender, would that be, would that make you trans?
I would say that it makes you more likely to become transgender, but again, it doesn't fully make you identify as transgender. Like, I could still go get a sex change operation and say, no, technically I'm still a woman, I just have different parts. Like, anyone can say whatever they want to say, really. So it's just like what society deems as standard.
Society or the individual?
Society deeming them transgender is because they got the sex change operation, but themselves personally, they don't have to deem themselves as transgender just because they got a sex change operation.
That's what I thought you were saying. Okay, so like, if I were to paraphrase that, I would say transgender is not about parts, hormones. It's about self-identifying?
Yep.
Okay. And is that equivalent to just like how someone feels about themselves?
I definitely think it's like feeling, mental health, like a whole array of things. It's a whole umbrella. It's not just like one specific pinpoint.
Okay. Okay. With the self-identifying, does that, and I'll hopefully ask you a question. You can jump in at any time. With these feelings, this identity, how does that relate to making these permanent changes? Does someone need, like, do the changes really matter?
Yes, most definitely. And I think that, again, therapy is really important for that reason, because you can be like really depressed or like going through a bipolar episode or anything like that that could alter your chemically imbalancing brain and like anything like that to make you want to become transgender in one moment. But then if you like snap out of that mindset and you don't want to anymore, that's like not someone who initially was going to be trans just because they feel trans. It's because they were in like an altered state of mind. So I definitely think that it depends on, again, case by case.
Yeah. Okay. Huh. And to figure this out, psychotherapy. Okay. Yeah. Do you think that sometimes, like, maybe the psychotherapy... Actually, you know what? I'm not going to drop that word sometimes. Do you think that it's possible that psychotherapy as a whole might be a good replacement for any type of permanent changes like surgery or hormones?
No, I don't think it should ever be a replacement. I think it should be in addition to.
Okay.
Like we were... Sorry.
Just to piggyback off that, it shouldn't be a replacement at all, but rather a step towards it. Kind of like when you're getting your license. First, you got to study like the roads and whatnot. Then you got to then you got to get your temps. Then you got to go, like actually drive on the road, get that experience. And only then can you get your actual driver's license after you do the driving test itself.
Okay. I'd like to kind of... I don't typically do this, but I'm gonna try it out here. So I'd like to introduce kind of an argument here. Now, there's a little bit of an age gap between us, I think. I grew up in the 90s, so I'm a little bit older. And in the 90s, there was this big thing, and it was just like, you be who you are, right? And I think that has translated to today. But I think some things might have changed, right? Like, I think in the 90s, early 2000s, there was this whole thing like, you're beautiful the way you are, right? If you're thin, you're beautiful. If you have blonde hair, you're beautiful. If you have black hair, you're beautiful. If you're black, you're beautiful. If you're white, you're beautiful. If you're Hispanic, you're beautiful. You know, it doesn't matter if you're female, male, whatever you might be. And some people are viewing the trans issue, trans people transitioning, as kind of that sentiment not necessarily being true. Like, if someone is a male and they have male genitalia, and let's say they want to wear a dress, be who you are. If you want to wear a dress, that's fantastic. But but you were born, with those genitals, I guess you could say, and like you would want to change that. Why? It's beautiful as is. Like,
I think that being beautiful and feeling beautiful are two different things completely. And also saying be who you are is a little bit hard, because if deep down they feel like they're a woman, then they are trying to be who they are by removing that genitalia.
Thoughts?
And it's just if you truly do think that if you are a woman and you want to be a guy, and then that should be and I feel like that sentiment should pass forward, where you could be beautiful as a transgender person. Yeah. But I believe that negativity was mainly just down to just simply it being such a new technology. I mean,
yeah, I think piggybacking off of that, as I was saying before, societal standards really is what changed all of that, and stigma and pressure and the family dynamic. Like, when you were a child, it was mainly nuclear families only, and when we were born, I assume you're around my age. Yeah, it was more so anybody can have kids, anybody can be a family, single parents are a thing, two dads are a thing. It's more than just nuclear families. That
is so interesting that you say that, because I was actually a single mother. My father, interesting situation, sperm donor situation. So I wasn't born in a nuclear family, but yeah, I would agree that it probably was more common. Gay marriage wasn't legal in the 90s. That was a more recent, what, 2007, 9, something like that.
It's like 2010 or something.
Something, yeah, I'm close. But, yeah, okay. Okay, so you said, like, inner beauty or how you feel about yourself on the inside is different than how you are on the outside.
Yeah, it's kind of the
Yeah.
same as body dysphoria and dysmorphic. Like when you're looking in a mirror and everyone else is like, "Oh my God, you're so beautiful," but you don't see that personally.
Yeah, yeah.
It's really hard for you to change your mindset on that just because of what people are saying to you.
I think we might be talking past each other because, yeah, like that's kind of what I was saying. Like
Okay.
on the inside, if you have that like self-loathe about how you are, how you appear,
Yeah.
I think that like that's really detrimental, right? And I'm not saying I have a solution to that, but I think I would like people to accept themselves and see themselves as beautiful, no matter how they appear, how they are.
Okay, but I think that's again is your definition of beauty because to them they could be accepting themselves as who they're going to become. Like, I mean, why do people dye their hair?
Okay. Yeah. People dye their hair.
Why would I get earrings? Like, it's all just a beauty standard to make yourself feel better. It's not about like what society is telling me to do.
Okay.
Yeah.
Okay. If I'm gonna throw out
Okay, good.
an interesting hypothetical here. It might trigger you. It might be a little triggering. So I apologize in advance if it does. But you mentioned the hair dyeing.
Yeah.
You mentioned like earrings, piercings. Let's bring I was gonna bring Alan in, but I'm Alan. It gets confusing. Let's say someone else walks up. Jenny walks up, and she's a white girl. She's got the coffee, but from Starbucks. Sorry, stereotype. She walks up, and she starts talking to us, and she's like, "You know what? I am kind of body dysphoric, right? I don't think I was born in the right body, but what we're not talking about. But it's not gender.
Yeah.
She actually believes that she was supposed to be a black, dark-skinned. Should we treat that in the same way? Should we, if she were to try to darken her skin, like with black paint or something?
I think that's another need for therapy. I think
Okay.
that most of it surrounds around mental illness and that you need to discuss that with someone.
Okay. Is that kind of the same thing as being gender dysphoric, like race dysphoric?
I personally don't think so. I think a lot of the time that race dysphoria comes from the way that your particular race has been being treated your entire life, so therefore you wish to switch to a different race. But at the same time, I suppose it could be seen the same for transgender people, but again, it's all societal standards.
Just to piggyback off that, I know a lot of people that I know a lot of white people that act like black people, but that's not to say that they themselves are more race dysphoric and whatnot. It's just that's just how they want to act.
And another piggyback, what's the definition of acting black? You can't really act a skin color. It's more so a stigma again.
I was more so not saying about the behaviors.
Yeah.
I was more so like,
Yeah.
more about the identity rather than the actions.
I definitely think that's more body dysphoric. Like that's like wanting to change your outer appearance. So
Okay.
yeah.
Okay. So it isn't a mental issue like you may have suggested?
Definitely probably still is.
Okay.
Yes.
What is so like the race dysphoria would be considered a mental issue, handicap, problem?
I would not say handicap. No.
Yeah,
I would
I
definitely
apologize.
no,
Saying
you're good.
handicap implies that it is inherently negative.
Okay.
Yes.
I think the best way to describe it would be more or less a belief, because there's no
Okay.
it's not like lack of a good word in all honesty, because if you say something like it's a problem, it means that it's negative.
Okay. What's the best, like if there's one word to describe it, what would it be?
Describe
That
what
you're
again? Sorry.
gonna- race dysphoria. You kind of said that it was some sort of they need mental therapy.
Yes.
Is that indicative that there's a mental issue going on?
Yes, I would
Okay.
say it's likely a chemical imbalance or some kind of past trauma has triggered them into behaving that way.
Yeah, I would say it's past trauma and just life experience. Many people that grow up in, I guess, poor neighborhoods and in more areas like that tend to grow up fitting into that stigma of that, I guess, hood-like person compared to someone that grew up in a more
Okay.
richer neighborhood that will grow up to be more rich-like.
Okay.
Sorry. It's just such
Uh,
a funny way to describe it.
Okay. So one might be described as an issue. Race dysphoria might be described as an issue. Would you describe gender dysphoria in the same manner or a different manner?
I would say it's the same manner that, like,
Okay.
you have a chemical imbalance that's making you feel that way, because there's no logical reason for you to feel that way unless, again, it's from trauma where something has happened that made you feel that way. Like, a lot of people who have, like, gender dysphoria and body dysphoria, it's from rape or past trauma. Yeah.
That is not the answer I was expecting. Wow, okay. Okay. If there is this trauma behind it or this chemical imbalance, should we try to, in treatment, should we try to address that instead of the kind of affirming or...
I think by addressing it, it is affirming it, because you're affirming that there is something going on and that there is a reason for them to feel that way. So it is affirming it by treating it.
Okay.
Again, I'm a
Interesting.
psychology student. I have a different aspect than most people would. So.
Yeah, that is really interesting. Would you take the same approach for race dysphoria in affirming it?
Yes, because you're affirming that they believe something is wrong with them and that they need to change in some way. So you're still affirming that they have those beliefs that something is wrong with them and that they need to change, but you're not affirming that it's okay for them to change their skin color.
And just to piggyback off that, it could also end up just not being them saying, oh, I want to change race, instead of just, and it could just end up being something like, oh, I want to be more accepted, or I feel like this is a way I can fit in more.
Interesting. So you said, like, you would affirm the feelings for the race dysphoria, but you wouldn't necessarily say, like, you should try to dye your skin
Yeah.
or something like that.
Yes, because you're then promoting self-harm. Because, like, bleaching your skin is self-harm, or dyeing your skin is self-harm.
Yeah, there might be negative consequences to that. Do you think the positives might outweigh the negatives?
No, because you're chemically, like, burning your skin. Like, it's not, it's not, like, with gender-affirming care, it's way different than with race-affirming care, because, like, race-affirming care is usually, like we said, dyeing or bleaching or, like, dyeing or, like, dreading your hair, like wearing dreadlocks or something like that. It's more so trying to fit in with that because of a specific reason, probably. But with the gender-affirming care, it's likely, like, a full thing that's been happening their entire lives. Whereas I feel like with race-affirming care, it's likely from a specific instance or, like, that year or something like that. It's not like their entire lives they've wanted to be a different race.
You also have to account for the repercussions of, let's say, a white person deciding that they want to identify as black and thus painting their skin black. There has been during the I believe during the civil rights period, many white people would put on blackface and whatnot in America, and that was seen as offensive and whatnot. But this is an American issue. You go to places like the Netherlands where that's not really much of an issue, but in America, if you were to dye your skin, let's say from white to black, then that could lead to negative repercussions.
Yeah.
And just make your situation possibly worse.
Okay. I think I'd like to stick on, like, the kind of the underlying how we go about figuring out if someone should do this rather than, like, outside perception. I mean, I guess that might be a factor, but okay. So I think you starts with a J. Jasmine. Oh, I'm never gonna remember. I remembered once. Okay. So race dysphoria, we got. Trying to remember exactly how you phrased it here. You would say therapy would be a good way to go. Same thing for someone who's body dysphoric, gender dysphoric, right? And you said that the person probably shouldn't dye their skin, bleach their skin or something, because that might be harmful. If, let's say, the person was doing it on their skin and it was like, I don't know, food grade quality, it wasn't going to harm them, but it was going to be pretty permanent. You know, it was like a permanent dye, but it's not going to hurt them. It's not going to burn them. Would that change your mind on that?
No, because I still think that it needs to be sought after in therapy because there's an underlying issue. All of it has an underlying mental health issue. None of it is really like, you don't just go out and say, I'm going to dye my skin purple.
Gotcha. So it's not something they would do the next day, probably not the next month. What about like after 2 years of therapy, maybe even group therapy? What about then?
If that's what you feel is best, and if you have a support system around you that is there to help you with that, then I think that's your decision. Just like there's a woman who made herself blind because she felt that she would feel better as a handicapped individual. So there's plenty of situations like this. She went to a therapist for multiple years. The therapist suggested that she shouldn't, but if she were to, that she should do it in a way that would be helpful, like being right near a hospital and doing it in the parking lot and being able to go in right away for treatment. Like if you're going to do something like that where you change your life, you need to have a support system around of people who are there to help you.
Yeah. Okay. Do you think that a medical professional should ever advise for hormones or surgery for gender-affirming care?
I don't think they should necessarily advise for it, but they should lay it out as an option because it is an option.
I don't think that they should at all. The healthcare system is quite expensive as is, and considering that most insurance companies wouldn't consider hormone additives, I believe that's right.
Treatments.
Yeah, hormone treatments would be considered a necessary expense and thus not pay for it. So it would just be an additional cost. So I don't think that they should I don't think that they should be the ones to say, hey, you should do this, and just let the person come to the conclusion all by themselves.
Yeah, I agree. I think giving someone like a pamphlet of like all of your options, here's what you could do, is like required in a way so they know all of their options, but I don't think you should ever be pushing one specific thing.
Okay.
I feel like an analogy for it would be like birth control. Like they're like, okay, there's condoms, there's IUDs, there's the pill. Like which one of these do you feel suits you best?
Okay, that's fair. I would like to try to steelman you guys. So that means try to represent you the best way I can in my own words.
Okay.
So I think both of you are coming from a similar position. I think both of you are saying that people should have the freedom to choose what they want to do with their own bodies. And that seems to be the primary driver for both of your positions, where it's like, with regards to gender affirming care, like whether it's whoever it is, whether it's children, adults, whatever, it seems like they should have the freedom, and medical professionals shouldn't necessarily say, hey, you should have this treatment because it best suits you. They should be saying, this is an option, and there's also the option to do nothing. That sound about right for both of you guys?
Yes, but I think if the person is leaning towards the option to do something and the doctor knows that, they should be required to go to therapy. That it should be a mandated therapy.
Okay.
Yeah, kind of like how I guess doctors would kind of treat a sickness IRL. There is multiple ways on how you can treat one sickness, but if the patient would prefer like one specific way for the treatment to be done, then the doctor should feel obliged to help assist in that one type of treatment.
Yeah, I feel like it's kind of like cancer. Like you have the option to do chemotherapy, you have the option not to, and that's your personal choice. No doctor's forcing you to do chemo.
Okay. I'm just going to ask a few more questions and we'll wrap it up.
Okay.
What could you learn, both of you, that would change your mind on this? Like what, like specifically, I would assume that, let me ask this first. For both of you, do you think that gender-affirming care should always be on the table for a medical professional to suggest?
I think some level of it, yes, because again, gender-affirming care is not always a trans surgery.
Yeah, I agree too. I think that it should always be available, but at a certain point in a person's life where if they meet the prerequisites, then they should be able to pursue that path.
Okay, gotcha. I'm going to rephrase it just slightly, tweak it. I'm going to specifically to sex change operations. Does that change anything?
Not necessarily. I just feel like there should be more steps involved to make sure that it's what you want to do.
Okay. Same.
Yeah, same with me. If as long as you meet the steps, you do what you need to do, then you should go right ahead with if you want to.
And what could you guys learn that would change your mind on this? That going from it should be on the table for medical professionals to say as an option to like taking a stance of it shouldn't even be on the table. What could you learn that would get you from there to there?
I don't think there's anything that I would need to learn. I've been friends with trans people who have been on T, like I've said before. Like my sister's non-binary. I think that it's really a case-by-case thing. You can't like learn something that would change your entire perception on how you feel most times. Like I feel like it might alter your feelings a little bit, but it's never going to fully be gone. Like
Okay.
I think that my same viewpoint on like being pro-choice, like that's another one that like I can hear everything I want about how bad abortions are, but at the end of the day I'm still going to feel set in my stance.
I feel like it could just come down to time saying that the current way that as more people get further into it, when it becomes more and more acceptable, the current method could end up being flawed, and thus we're gonna have to put a pause to it, try to figure out a new way to do it later on in the future. And considering that how new LGBTQ has been accepted and whatnot, there's still many things that we got to go through. There's going to be some bumps in the road in order to achieve the best path, but we're still just got to go figure out and see what happens with it.
Okay. I think this might be one of the last questions. So, it sounds like you could learn some other things that might change your mind, but it sounds like you're not really sure exactly what they were. You seem to be more set in your mind. It seems like you've learned enough to a point where it's like knowledge and kind of like there's nothing else out there so that could really change your mind. It seems like it's set kind of in freedom in a lot of ways.
Yes,
Okay.
freedom and the aspect of like I know that there are bad consequences. Like I know people have killed themselves from regretting
Yeah.
surgery and stuff like that, but at the end of the day, again, it's a case by case.
Gotcha. Okay. If there was something that isn't surgery, that isn't hormones, let's just say it's a little tiny pill, doesn't have any side effects, but it makes someone body dysphoria, gender dysphoria. Where do you have to be? Am I keeping you from somewhere? Okay. So little pill, it's that big, no side effects. It's not gonna give you cancer or anything like that, but it will just take all that body dysphoria, gender dysphoria, and just it's gone. Would you take off gender affirming care if that was an option?
No, just because I feel like sometimes in certain situations, people who want to become trans aren't even body dysphoric. Like there's
Okay.
plenty of people who are happy as a man and happy as a woman, but just feel that they prefer to be a woman. So I don't think that's always like a necessity. And again, gender affirming care is not always about being trans. Like I
Gotcha.
said before,
Yeah,
you can
sorry.
get a breast reduction, you can get a penis enlargement. Those are gender affirming care.
Yeah, and just to piggyback off that, like you mentioned with the pill, I feel like that could be a choice as an alternative.
Okay.
And just if you don't want to, and if you decide to change your mind with all the process and whatnot, you could just take the pill and suddenly just not feel like wanting to have a sex change anymore. If you do think that the pill is the best choice.
Okay. Both of you guys would be okay with that new treatment,
Yeah.
assuming it was safe and it would have been studied, whatever.
I just don't think it's an end all cure all.
Okay.
Yeah, I think it's just an alternative saying if you would prefer to have this, then you could take it. If you prefer to have the sex change, then you can have the sex change.
Okay. Did I miss anything? Is there anything any of you guys would like to say, talk about? Did I not ask something good? Was there any problems? Anything?
I don't think there's necessarily problems. I think that I don't know how much research you've done on it personally, but I think before having an interview like this, to have some background knowledge on it is very important.
Okay.
Yes.
Do you think my background knowledge is poor?
I don't think it's necessarily poor, but I think you still have a lot to learn before you fully debate this with someone.
Okay.
Yeah.
How would I go about learning more?
Research, just doing research, reading books, watching YouTube videos. There's plenty of ways to learn about it.
Okay. Anything from you? Any last?
No, I think it's been real good and all. I'm not used to debates myself, so I'm quite inexperienced when it comes to it. But yeah, I got no complaints or anything.
Okay.
Cool.
Terrific. I think that's it.
Thank you. Are you going to mention our names at all in it? Because I would prefer if you did.
Prefer that I did.
Yeah, I search myself up a lot, and I have a lot of articles about myself, so I would
All right.
love to
Sure,
see
my
my
mom
name in
would
it.
love
Yeah.
all of those.
Should we do our spelling of our names?
Go ahead.
Okay,
Yeah.
it's JASMINEPULS.
SHANE.
All right.
Okay.
Cool.
Thank
yeah,
you.
I'll put the names on.
Thank
And
you so
much.
feel free to email me about
Yes,
the.
I absolutely will.
All right.
Thank
Cool.
you.